Hello everyone, welcome to Raaonline.co.in. In this presentation, I'll be talking about the management of an intercostal drain. Intercostal drain, also known as a thoracostomy tube or ICD. It's one of the commonly performed procedures in the medical ICU as well as in the surgical ICU, especially in the cardiac surgical ICU, as well as for patients in the emergency room who have been victims of road traffic accidents or any trauma. Right. This is how I'll be going through my slides. I'll be talking about the indications, the contraindications of ICD. How do you prepare a patient for ICD insertion? How do you select the right tube for the patient? What are the insertion techniques? What are the drainage systems currently available? How do you manage the ICD once it has been placed? What are the complications of an ICD? Slide about the pediatric ICD, and finally the summary or the conclusion. Right, to begin with, thoracostomy. What is it? It's a procedure by which a small tube or a catheter is placed through the chest wall into the pleural cavity. Now, the tube can be small sized or large sized depending upon the indication. I'll be coming to that. The aim is to drain air, pus, blood, or fluid, and it can also be used to instill agents to treat empyema or malignancy, that is, with the intention of causing pleurodesis. Now, ICD insertion, as I was telling you, can happen in the ER, that is emergency room, in patients who have been victims of road traffic accidents or any trauma, or it can be elective procedures in the ORs or in the medical ICU. So that makes the anesthesiologist at the center of such a procedure. So he must be aware about the placement, management, and to troubleshoot the ICD, because most of the ICDs will be managed in the critical care units or in the ICUs, and the anesthesiologist is the one who is attending to these patients. So he or she must be aware about the problems with an ICD and how to troubleshoot the complications. So most of the literature that is available for an ICD is only for adults. That's because probably children rarely experience situations that require an ICD placements, except probably in the OR. Now, there are various types of chest tubes available to us. They can be angled or straight. In this picture, I have shown you an angled tube at the bottom and a straight tube.